boy, it's a beautiful morning this Saturday. So excited to be with you guys here on today's A Different Perspective. We have a quite interesting topic today that's going to really set the stage for a lot of things that people suffer with today. Now, I'm going to say to you guys, do me a favor on this one. You need to follow with me the whole time I go through this. This is a very, very sensitive topic because anxiety has been diagnosed and people have been suffering with it for a long time. And almost 40 million people last year alone were diagnosed with this. If you look in the population of just the United States alone, that's a significant amount of people. So we're going to really dig into this deeply. And I believe I'm going to give you such a different perspective that what we're going to be able to do from the start is actually go from the beginning, take a look at what's said today, and really give you a different approach. You know, you guys hear me say this repeatedly because I think it's a basis for almost everything that we do, is we're not moving in the right direction. I mean, I put this picture up here and say anxiety, a different perspective, but this is common. You got what I'm saying? Now, anxiety is very common, but that doesn't mean it's normal. I can honestly tell you, with all of the ladies that I and the other doctors across the country have dealt with, it's huge. It dominates in mainly the female population. It doesn't mean that men don't actually suffer from anxiety. I can honestly tell you, something happened yesterday. It's kind of interesting. I always say, you know, God has a funny way of doing certain things. Now, once again, obviously, I'm very private, but this happened yesterday clinically here in Green Bay. There's a patient I took care of for many years. He is a very great businessman here in town. He's a loving individual. He is a great husband. He has great kids, but he suffered massively from anxiety. He came here. His whole life changed. His wife was extremely happy, all right? So we did what we do with him, and the great thing was he recovered beautifully. I put him on the right direction that helped him not only overcome his anxiety, but see a better aspect of life. Well, this does happen with a lot of people. All of a sudden, guess what? When people are doing really well, guess what happens? I don't see him for some time. So as I told you before, you know, I don't take new patients, but this is a guy who was dear to my heart, being a patient for a long time. And I honestly haven't seen him physically for over 2 years. And then on Thursday, this past Thursday, I get a message from him pleading to come see me. He even said, I'm in a bad state of anxiety. I haven't even slept yet that night. And my wife is now, she went from begging to telling me, quote, to call me, okay? And I had him come in yesterday. And it was interesting because there's major things that people miss. Now, this is not a joke. He didn't choose me first, even though I helped him before. He actually tried some meds, and it went very badly for him. They even overdosed him. My point is this. Anxiety is extremely real, and it can devastate your life. Even being a great mom, a great dad, a great husband, a great wife, a child, all this. So it's something that has to be taken very seriously. I will just tell you today, I'm going to give you a very different perspective, and it's going to make some people upset. Look at when we advertise for anxiety today, okay? And what I mean by this, look at I just said I was speaking on anxiety, and go back and look at the comments that people are making. Man, there were some nasty comments that people made about it that way. And that's okay. I understand, because people really do connect with their issues, all right? So if someone comes along and says something different, it makes them downright mad. Do you understand that people get more intense about their feelings ever than they do their actions? Think about that. They so dig into their emotions, but they do nothing as far as actions to change them. Well, I'm hoping to do that today. I'm hoping to give you such a different perspective because I see it so differently. And then we'll be able to apply that to the Wellness Way approach all over the world. So today, anxiety, a different perspective. So here we go. Grab your coffee, grab your kombucha, have a sip. I will tell you that we have some special guests at the end. I even have my 16-year-old daughter here in studio today with our media team and stuff. So I'm excited to share something. This is dear to my heart that I'm gonna talk about because of all the women, mainly. Obviously, guys suffer this too. But I can actually give you such a different perspective. And here we go. Now, this morning, our media team, I wish I could have took a picture of them when I did this, okay? Because here's what happens. When you see things differently, it kind of shakes and rattles people a little bit. So I want you to tell me when I put this thing up here, what do you see? All right? So I'm going to just step aside for a second. What do you see? And my media team, both Brandon and Uriah right now, they're here today. They laughed and they said, I see a young lady. And they were like, I said, cool. I said, I see an old lady. And they're like, and Brandon was like the dog that was looking at a new dish. He was like, you know what I'm saying? What? This is just new. I don't see what you're saying. Okay? He had the head tilt. I thought his tongue was going to drop out of his mouth. And it's like, what? Here we go. And it was funny because I saw these two young men looking like, we don't see an old lady. There's an old lady there. But see, what happens is you can look at the same picture and see two totally different things. Now, they see the young lady. There, they see her head turned to the side. They see her ear. There's her nose, her eyelashes. You know, it's like she's looking over her left shoulder. All right? But I said, guys, don't you see the old lady? And they're like, no, where? And they were looking at it. And looking at it, I'm like, do I really have to point it out to you? And that's my point. My point is, we can look at the exact same thing. We can look at the exact same picture, but see something totally different. Now, if you don't see the old lady, let me show you. Here is her right eye, her nostril, her nose, her mouth, her hair, okay? See, so what happens is people, and you've just seen these two, they're like, I didn't see that. I didn't see that. Well, I believe, once again, that's why I always try to give you a different perspective, okay? Now, do me a favor. In the comments below, when you first saw that, tell me what you saw, okay? And tell me if you saw both. So I want people to see that, listen, you can look at things very differently, even though that people say, no, that's a young lady, no, it's a young lady, and I literally had to point it out to them. That's what I'm going to do with anxiety, because once again, it's a very big picture I believe people are missing. And by the time that we're done, I'm hoping to share my evidence and my perspective on it, the Wellness Way perspective, to actually get people to go in a different direction. Because the one thing is this, yesterday, that great man came in here with massive anxiety, and guess what? They over-medicated him to the point they almost hurt him. They put him into psychosis, okay? It's not a joke. So I take anxiety extremely seriously because it can devastate not only a great man, a great woman, but a whole family. Okay, so let's really get into detail in it that way, because you know me, I like to really define things. So our first thing on anxiety, what is it and what is the current form of treatment? Now, why do I bring this up? Why do I always talk about defining it and actually talking about the current treatment? Well, people come into me all the time, they say, Doc, guess what? I have anxiety and depression. I'm like, no, which one? No, anxiety and depression. No, which one? Because anxiety is different than depression, and how you approach it is going to be extremely different. Well, no, my doctor said I suffer from anxiety and depression, he gave me medication. Well, then they don't know what they're doing, because they're extremely different. They actually have different causal factors. They're actually biochemically different. They're actually dramatically different on the emotional spectrum. So that's why, if you ever notice, I really like to define how they do it. And of course, I'm going to pull out the most well-known medical establishment in the world. It's kind of funny. No matter wherever I travel over the world, if I bring up Mayo Clinic or if I bring up Cleveland Clinic, they're two of the most well-known established places, you know, globally. They really do, okay? I've been over to the Mayo Clinic. I've spoken in their areas and stuff. We actually have a clinic over there, okay? Now, the one thing about it is this. They actually are the dominant thought and actually the center for where people establish it. It's like when people are really sick and their current doctor can't figure out, they'll refer them there, okay? Because they're known as the best diagnostic place in the world. I didn't say care place in the world. They're known as the best diagnostic. So let's look at how they define it. And once again, you can jump on their website, just type in Mayo Clinic and anxiety, and you can follow around with me when we do this, okay? Let's pull up our... So anxiety disorders, okay? That's very important. Anxiety is a general term, all right? Now, let's go through how they define it and what it really is and see, for example, if it makes sense. Okay, overall, experiencing occasional anxiety is a normal part of life, all right? Now, once again, just because it's common doesn't mean it's normal. See, because we never teach people what anxiety is and how to overcome it, all right? And I know some of you just right there for me saying that, said, he doesn't understand. No, hold the phone. Hang in there with me. I do understand. I've dealt with this clinically. I've never dealt with it personally. So let me say this. I've never dealt with this personally. And I believe I know why I have never dealt with this personally. I'm going to walk you through that, okay? But hang in there with me. However, people with anxiety disorder frequently have intense, excessive, persistent worry and fear about everyday situations. Yes, I totally agree. I see people just like the person that came in yesterday. It's very devastating. It's intense. Their body is responding in some significant ways of nervousness, restless, tense, impairment of danger and panic, increased heart rate, okay? Breathing rapidly, sweating, shaking, okay? I literally watched people just tremor, sitting there consistently. I can honestly tell you, I was new in practice. I'm gonna tell you some things of how I started to really figure some of this stuff out. I was new in practice, probably maybe 4 or 5 years into practice. And a guy literally brought his wife in with his arms wrapped around, walking with her up to my front desk, and she is trembling and shaking. And now, at this time, thank God I already had some experience with anxiety, but it freaked out my new front desk, okay? And all of a sudden, they're like, and she came in, and she's shaking, and no appointment, no nothing. The husband just said, we need to see Dr. Flynn now. And she was sitting there bent over, just shaking and trembling in massive anxiety and great panic. And so I walked out and I brought her back to the exam room, and the husband said, listen, she's been like this. I don't want to take her to the hospital because all they do is sedate her and basically knock her out. And we've been there over and over and over again. And they have no answer. Now, I don't want to take away, and we'll continue the story later, I don't want to take away that what she was going through wasn't devastating, because it was devastating to both her and her husband. But she was basically in intense sweating, impairment, extreme fatigue. Panic was huge, okay? Experiencing gastrointestinal problems. I bring that up is because the woman, for example, as she was there, she lost control of her bowel. So it's very tough. Those anxiety attacks are devastating that way. And the husband's a little embarrassed. I'm like, don't worry about it. Don't worry about it. She's sick. She's going through something horrible. Let's just bring her back to the exam room. And no joke. And let me fast forward a little bit this way. And I'm going to come back to more story that way. I'm like, I literally, and this is not a joke, but I want to tell you the end within mind is I'm like, all right, think about this, all right? I'm like, how am I going to get labs on her? She's trembling. You know, how am I going to do these things that way? I literally walked up to my middle, grabbed a bottle of California Poppy, and I gave her a tablespoon every 5 minutes, and within 20 minutes, she stopped shaking. We'll get to that in just a little bit, okay? And now, still to this day, she hormonally is doing amazing. She had a couple kids since we've been there. Husband and family have been under our care for a long time. And she hasn't been back to the hospital in a long time. And I'm going to walk you through some of the stages that happened to go. I showed you the beginning, I showed you the end. Now, that was just the end of that appointment that day, but what's kind of happened through her through this story. Now, and I got multiple stories to share you with this, okay? But these are real. These are intense. They get extremely bad. The feels of anxiety and panic interfere with their daily activities. It's difficult to control the outcome. I mean, literally, this guy, actually, her husband, her life was devastated. This woman couldn't work. She couldn't do things because the anxiety was extreme bad. And I say, Doc, I'm not as bad as that woman. No, but some of you guys deal with fear every single day. I'm going to show you clinical examples where women wake up and they already have anxiety just getting out of bed. And nothing's even happened yet. There is a biochemical reason. Okay? So look at all the symptoms. Now, what they do, and that's why they call it anxiety disorder. What they do, and this is what medicine always tries to do, they try to put a label on it. So if you fear getting up in the morning, if you have a panic disorder, or you have separation anxiety, which once again is real. I'm going to show you a clinical example of that. So what they're just doing is defining the fear, the anxiety, the panic, the emotion, the symptoms you go through based on your experience. And that's why they call them anxiety disorders. So actually there's really no such thing as anxiety. It's actually the fear and panic of so many situations of life. All right, and I understand that. That's why you see all of the fears that they list. Now, when to see a doctor? You know, when they say, when the worry becomes too much. All right? Now, it's kind of interesting because causes, there's medical causes. We're going to get into those, okay? They say there's risk factors. You know what's really funny? I can honestly tell you, this is one condition that they list that they don't put genetic in. I'm actually extremely happy about that, okay? Because we have to stop telling people that their problems are genetic, because that means they have no control over them, okay? A person that has Down syndrome and has trisomy 21, once again, has no control over that genetic process. But the person that suffers from a lot of conditions, they're not genetic, okay? Now, once again, here we go. And they list about trauma, a lot of stress, mental things like that. Complications, once again, medications itself, all right? Prevention. They don't really have stuff besides stay active and avoid alcohol and get up early. That's their idea of prevention of anxiety. So if you wonder why anxiety is at all-time high, it's because they're doing nothing to prevent it. Conditions are preventable. And once again, this is a very common condition. So let's look at the diagnosis and treatment for it. Once again, psychotherapy and medications. Psychotherapy and medications. Now, but how do people get diagnosed with anxiety disorder? When we posted that I was going to speak about anxiety, man, there's one woman on there, probably because she suffers from anxiety, said, leave it up to the professionals. Okay, let's see what the professionals say you need to do in order to be diagnosed with anxiety. Compare with symptoms to criteria of the DSM-5, okay? This is the whole diagnostic criteria that medical put up to put a label on it. So let's pull it up. Let's pull up their code, their CPT code, their diagnosis code for anxiety and the criteria for it. Every doctor has to follow this. Here we go. There you go. One page of criteria. Here's what it is. Excessive anxiety or worry occurring more days than not for 6 months. My goodness, that just explains just about everybody on the planet, okay? Because people worry every single day, and I believe I found out why, all right? Second of all, individual finds it difficult to control worry. I can't make this up. I'm pulling it right from the criteria, the diagnostic criteria that they put from here. Anxiety and worry are associated with 3 of the following 6 symptoms. Relentless feeling, keying up, being easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disruptions. Now here's the funny part, watch this. For children to be diagnosed, only one item is required for children. So if your child has a problem sleeping, they can have anxiety. So for the person that wrote on there, leave it up to the professionals, they diagnosed you guys, what do you think's coming next? Some form of medication. Some form of medication. It's why the standard care, everybody is on some form of psychiatric drug today. Man, when I was a kid, there was no kids on psychiatric drugs. Now, guess what? And I know, for example, get this, and this is well documented, and I'm gonna probably make some people mad when I say this. You know, we're so big into gun control, excuse me, one political party is, and what they do is they dangle these school shootings on guns. There's one thing that people don't realize that's been documented with all these people. They're on some form of psychiatric medication. They're on some form of psychiatric medication. Okay, and if you look at some of the side effects of the psychiatric medication that they actually want people to take, guess what happens? One of the major side effects of these medications is suicide, harm. It's right on the box. You understand? They're trying to manipulate biochemistry to get to alter your anxiety, which can lead to other things. And so the sad part is this, if this is what we're leaving up to the professionals, I'm sorry, you have the wrong perspective on life, and it's probably why you have anxiety in the first place. So understand that this is the professionalism we have. There's more diagnosis, there's more medications, it's just going to continue to get younger as the process goes on. Now, saying that, what do we need to do, okay? So once again, I do agree that there are medical causes of anxiety. I've physically seen them. So when you look at the medical causes that come there, heart disease, diabetes, thyroid problems, drug misuse, okay? All these things, chronic pain, irritable bowel. All these things can actually be medical problems, physical problems, and biochemical problems that can lead to that. So let's do this. Okay, so let's take a look at what these things can do. And so if you go back to the criteria, so I want to give it to you a little bit closer, look at the criteria that they give you. The criteria that is diagnosed by the DSM-5 is it doesn't take much. If you have any worry for more than 6 months, they can say, listen, you have anxiety. And I'm not saying the worry is not there. Let me say this again, because I know some of you guys are watching this that suffer from anxiety. I get it. I know that you are suffering. Don't think I don't know that you're suffering, all right? But their criteria for this is what? Is you have worry, you have restlessness, you can't concentrate, you can't sleep, you're diagnosed with anxiety, and the concept of the therapy that they give today, and the concept, for example, of medications they give today, if this is our pattern, it's going to be very continually suffering for people that have been suffering with diagnosis of anxiety. So once again, I just wrote out for your notes, once again, the things that they listed there. Now they said, well, and also all these health conditions. So let's go over that, okay? So I had my light bulb moment. I did. I'm like going, oh my goodness. If you look at anxiety itself, what happens is this. There is a response, and then the body moves in a certain direction, and it causes that consistency. So I started to go, oh my goodness, this is a stimulatory response, because there is biochemical and physical changes that do happen through this. So I'm like, there has to be more things that start to trigger this. But then I realized, yes, there are physical things. Yes, there are biochemical things that do contribute to anxiety. But then there's also something that is a huge contributor to anxiety, and that's emotional. So we're going to break these down. I'm going to show you that, yes, there are physical biochemical things that do it. But I can honestly tell you, number 3 is probably the biggest contributor to anxiety. And then I'm going to give you clinical examples of how I've taken the majority of women, okay, that suffer from this, and actually show them a different path, give them a different perspective, so they now don't have to deal with this. I'm telling you right now, if you listen to what I'm going to tell you over the next, breaking these 3 things down, if you're massively suffering from anxiety, it's going to fall in these 3 categories, and I'm hoping to lead you out of that to where anxiety is not a part of your life. Clinically, we've done it for 20 years. Clinically, the offices all over the country have done this. I have one of our clinicians, one of our doctors here from Colorado today that you guys are going to meet at the end. She personally has actually dealt with that in her clinic for several years and helped people with it that way. Now, but it's a different perspective. So here we go. So let's start to go through some of these things that actually create that stimulatory response. Because if that constant stimulation is there, let me give you an example. So let's say right now that you suffer from anxiety or don't even have anxiety. But let's do this. Let's take a small pebble, just the smallest pebble, and I'm going to throw it into your shoe today, and I want you to walk around on that shoe, walk around all day long with that pebble in your shoe. Let me ask you a question. What's your mindset going to be like at the end of the day? Yeah, even everybody in the studio is like, you should see their expression. They know they're going to be irritated, angry, frustration. They won't be able to get out ahead. It's a constant irritant that way. You bet. And that can relate to a lot of anxiety, okay? So then if you look at some of the physical things, okay? Now listen, this is on the California government website talking about medical things that mimic anxiety, that can create those factors, okay? So this is actually a medical website. This is a government website. I laugh at this because watch, we talk about this. Yes, hormonal problems, no doubt. That's why I said clinically, I've dealt with this for 20 years because I'm going to share some of those clinical examples like I told you about that woman that had those massive tremors coming in with massive anxiety. There's also metabolic, diabetes, stimulatory, sugars, processed sugars, artificial sweeteners, glutamate, MSG. All these things are physical stimulators to the neurology to create anxiety. If you even look at some of the things about artificial sweeteners, it's actually listed as a neurological stimulant. And if you're consistently drinking them, in diet sodas, processed products, certain, Starbucks lattes that have those things in. That's why you see those yellow and pink packets on all the food places. Guess what? They create anxiety, all right? Now, cardiovascular, pulmonary, neurological things. Epilepsy itself is actually an anxiety-based condition. Now, medications. See, look at this. Medication, another physical and biochemical contributor to it this way. Other things, anemia, vitamin D deficiencies. And this is even on the government website. Heavy metal poisoning. Heavy metal poisoning is a medical mimicker of anxiety, which means actually it's causing anxiety-based things. Well, I wonder if they've done some research to find out, oh my goodness, here we go on PubMed. Exposure to mercury and aluminum in early life, the developmental vulnerability. Let's say this all over again. Vulnerability, because a developing child's brain is extremely vulnerable to damage from mercury and aluminum. It's been studied massively. What do we do to a child very shortly after it's born? What do? We poison them. And you guys call that immunizations. I call it poisoning because that's what it is. Okay? Now, as a modifying factor to neurological and immunological effects, it's been documented so well. That's why people say that there's no research. What are you reading? There is a significant amount of research, and it even talks about, as you read down more to the conclusions, more research attention has been given to ethyl mercury and aluminum, and findings have showed a solid link with neurotoxic effects in humans. So you wonder why children are massively suffering from anxiety. You wonder why developmental neurological disorders and psychiatric disorders are all-time high. How are we starting our kids off? They're getting crappy food. They're toxic. They have health conditions at an all-time high. And those sick kids are going to carry that anxiety and illness to later in life. It's why 40 million people, men, women, and children, in a country of 360 million people, have been diagnosed with it. It's going to continue to go up if we don't change our thinking and come with a different perspective. Now, let me give you a clinical example. Here is a beautiful 7-year-old girl. Here was her things she was going through. Separation anxiety disorder. She'll get aggressive. She'll go from aggressive to actually tired all the time. She'll actually have massive mood swings. She can't sleep. Doctors want to just medicate her. They don't even want to do psychotherapy with a 7-year-old child because what are you going to talk to them about? This child doesn't want to talk. This child, for example, if the mother leaves, downright gets aggressive. All right? So they came in, 2 wonderful parents, loving family, great family, actually. I've gotten to know them, and husband, great guy, mom, great woman, that way. Other kids, once again, and so what happened is this. So I went through, I said, listen, we need to test some of those things that can contribute to it that way. Especially, we talk about heavy metals. We also talk about some of the peripheral neurotransmitters that can affect her brain, all right? And so here's what happens. So a young 7-year-old girl, once again, you have neurotransmitters that calm the brain down. They're called inhibitory. And you got neurotransmitters that are excitatory. See, for example, one of our major excitatory hormones for our brain is histamine. Histamine. No, doc, that makes you get a sniffly nose. It's a neurotransmitter. It's excitatory towards the brain. It can cause that acceleration, that stimulation. So I wonder if foods could do it. Can food stimulate it? Absolutely. That's why the histamine response get there. Also, glutamate, the most excitatory neurotransmitter of the brain. If it gets too high, it can cause apoptosis, which is programmed cell death of the brain. Well documented in study. Well, glutamate, why does it sound familiar? MSG, monosodium glutamate. So that's why people say, oh, something, everything's okay in moderation. Your brain doesn't know moderation. Your brain doesn't know, for example, a little bit. It's either excitatory or it's inhibitory. Now, look at this poor young 7-year-old daughter, 7-year-old girl here. Her serotonin, her peripheral serotonin, extremely low. And can anybody tell me where the majority of our serotonin is produced in the body? Right there. Right there. So next time that you actually find yourself eating something and it triggers anxiety, don't be surprised. You induced it because you can damage your serotonin production. You can overstimulate the neurotransmitters that are made all the way through the body, and it can greatly enhance the worry, the fear, the panic of the brain. It happens clinically all the time. See, so for example, as this 7-year-old girl, once again, now this is not the only labs that we did. We actually investigated the stimulatory things, the physical things, the biochemical things, the foods, the bacteria, the things like that, that actually contributed to what happened to her anxiety. Now, great outcome. See, that's the cool thing is this. Their outcome and their perspective is, well, we need to medicate her. And the parent's like, oh, the phone. Why would I want to do that? And the doc said, that's the only thing that can be done. Guys, once again, sometimes I sound like a jerk, but sometimes I have to be. Because when doctors tell people that, it's actually a disgusting comment that they should never tell anybody. That's the only thing that they can do. Because once again, they're misleading people, they're actually lying to them. Just because they're ignorant and don't know doesn't mean that's the only thing that they can do. It's very sad, because what they would do, what would be this child's future at 7 years old if they continued to medicate her? If they took it off, here, medications do work. It will change her brain. It will change her body. And the sad part is, then if she ever wants to get off, trying to get off it is difficult. Not saying it can't be done, but difficult. And so if they just stop, their problems come right back. Sometimes medications give you the excuse not to change your behaviors. Let me say it again. Sometimes medication actually, oh wait, how did I just say that again? Come on, media team. They actually give you the excuse not to change your behaviors. It's kind of like, for example, it's sometimes when you have a mental stress, the actually medication actually changes your behavior where you don't deal with the mental stress, but the mental stress still is there, all right? So kind of common. This is very common what they're doing to kids today. Well, let me give you another example. Here's a 33-year-old woman. Here's what she had. She had massive anxiety. Hypothyroidism. Doctors say there's no connection. They really told her that there was no connection, even though it's listed as one of the most stimulatory things to our body. Our thyroid is by far the most stimulatory thing, even a little bit more stimulatory than our adrenals are, our fight or flight system, to the fact where the thyroid can cause your eyes to pop out of your head. The thyroid can actually have your thought processes go so quickly and so rapidly, it can lead to a massive panic attack. One of the major symptoms of hyperthyroidism is panic attack and anxiety. Yet the doctor said there was no connection. But you know what they did want to do to this woman? Rip her thyroid out. Rip her thyroid out. See, what I hear from the advice from doctors, they're actually psychotic. They're psychotic, the advice they're giving this person, okay? Now, can't sleep, tired all the time, infertility, she's now pregnant. Doctors want to medicate her. That's their scenario. We got it, but then when they take these medications, but then they even warned her, at least they gave her this good advice. They said, I wouldn't try to get pregnant while you're taking these medications. Yeah, because it's detrimental to her and her developing baby, okay? So now the cool thing is, this woman doesn't suffer from any of these anymore. Let me show you her labs. Here's a perfect example. Her T4 and T3 hormone were extremely elevated. So those are your body is going to respond to that stimulus. She metabolically started to continue to lose weight. She started to get really thin. Eyes started to pop out of her head. Hair and skin got really bad. These whole things, anxiety, can't sleep, tired all the time. Sound familiar? Now, the cool thing is, when I retested her in about 2.5 months, her T4 levels and T3 levels still high, but continued to come down because they told her it could never happen. But she started to see less anxiety. She started to see her weight maintain. She started to see all these things. Now, once again, I've retested her 4 times already. And the cool thing is this, now she's pregnant. And she's messaging me all the time, and she's enjoying her pregnancy massively. It's kind of cool. I just got a message from her yesterday. So that's the beautiful thing. Now, once again, what was this caused by? She had some immune triggers, okay? And what it did, though, those immune triggers contributed to her hypothyroidism, her Graves' disease, which now led to her anxiety and all the things that were there. So was the anxiety and the emotions real? Absolutely they were. But most of anxiety is actually started and contributed to by a stimulus. Do you know why? All of us have worry. All of us have fear. But if you have a physical or biochemical thing, it just accelerates the stimulatory process of it that way. Okay? So let me give you another example. Here's a 34-year-old woman, anxiety. She's a fitness expert. She can't sleep. She's tired all the time. Mood swings. Guys, trust me. I can almost call what they're going to say. Doctors want to medicate her. It's so repetitive. You know what I'm saying? I basically, if I have a woman that actually has done any fertility stuff, I don't even have to read what they've been through. I can say, you've been through this, 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 and this. And like, yeah, doc, how do you know that? Because it's standard. I know how they think. See, their perspective, it's almost repetitive. And I've never met any woman that's the same as next. I've never met any man that even if they suffered from the same condition is the same. All right? So let's look at her labs. You get this. Here's what I talked about. Now, if you looked at her, she's in great shape. If you looked at her, no joke, her foods were great. But guess what contributed, the biggest contributor to her anxiety was? Exercise. Do you want me to say it again? Exercise. She was stressing out her body, and she was working out so hard at night because she has an image to actually put out there. So she had the mental stress of she is a fitness expert. She has to be able to get on Facebook, has to be able to get on the internet. She has to put her shorty shorts on and her halter top. And she was mentally stressed, so she was hitting it hard at nighttime to exercise to make sure her weight was down in the morning. And her cortisol levels were elevated when she woke up, and she's like, Doc, I get up and I'm already stressed. The anxiety, the panic attacks are already coming. You know what I'm saying? And I'm like, guess what? Has anybody taught you how to exercise for your cycle? And she's like, what? I said, listen, you may be a fitness expert, but you know very little about the female body. See, I find this always funny. I find that the criticism I get because I'm not a woman, but I understand the female body better. I'm saying this humbly that way, and with humility, that I understand the female body more than most women ever have. That's why I actually got known, because the idea is this: women cannot exercise all the way through the month. Women cannot fast all the way through the month. They are not a guy, okay? So exercise alone was affecting her blood sugar and her cortisol levels. She became so hypoglycemic that guess what? Her cortisol levels, her stress hormone that helps you maintain blood sugar also. People don't realize that cortisol actually helps maintain your blood sugar more, if not then, of insulin. So she was working out so hard at night. Ladies, don't be working out at nighttime, okay? So what happens is, so then by the time she actually woke up in the morning, her body was so hypoglycemic that what happened was this. She woke up in panic attacks. Imagine that. She worked out. She thought she was doing everything right. And she was actually creating that process. She was doing it. Okay? Now, and the funny part is this. All the things that they went through, guess what happens? All these conditions were worsened by any emotional stress. Their anxiety, their heart rate, everything. So they were predisposed by some physical biochemical things. But what they found out is when they thought about it and that thought came in, it just accelerated the process that way. All right? And I agree with that. I agree when you're sick emotionally, it's very difficult to forget about it. And you keep on replaying that over and over and over again. So I started to really listen to men and women. And I said, what are these emotional factors that are causing people to actually be stressed out? And I just listed a couple of them. Maybe be your spouse, your work, your children, people. People in general. See what I'm saying? People in general. Money, situations, experiences. Yes, yes, yes. I've heard them all. I heard them all. I remember, for example, sitting in a consult, and this has really changed the direction of how I thought about hormones and actually how I actually looked at some of the things. And as you guys know, I've said this repeatedly, that I believe emotional stress has contributed to more illness than anything on the planet by far. okay? And then on top of it, if something else contributes to it, like if a child gets damaged by vaccines or an adult does or things like that, the emotional stress just exemplifies it and continues to push that process in a very negative way. So I was sitting down with a young lady one time, and I think she was about 28 years old. Don't quote me exactly, but she was around 28, 29, 30 years old that way. And I'm 2 years into practice. And she is literally sitting there. She has anxiety. She has a bad cycle. She has all these female things. And I'm getting to really figure out all the female hormone stuff that way. And I start with her, okay? And I get her labs back. And I see all the hormones off, and I see the thyroid off. And I start doing things with her. But I didn't really understand the emotional component yet. I didn't. Remember, guys, people think that I came out of school knowing all this stuff. That is not true. I can honestly tell you, my schooling gave me some background and some biochemistry and things like that, but their perspective was different than I'm even teaching you today. That's why I go speak at colleges, go speak at chiropractic schools and medical schools, things like that. I'm like, man, they're lost, okay? So I'm sitting with this young lady, and I was doing all the right things. I was giving her the right things to take. I was adjusting her. I was doing everything. I did her food allergies, everything like that. And she came back 2 straight months, and no joke, her anxiety wasn't changing. And what happened is I started to really like, oh my goodness. And I saw no progress. And then all of a sudden, she was telling me, and I'm like, and I'm not joking, guys. Imagine this. I'm probably like, what, 26, 27 years old this time, and I'm having success with other things that way. And I was sitting there, and I was actually getting frustrated. I was getting frustrated with myself, going, what am I missing? And I was getting frustrated with her, going, oh my goodness. And you know why? Because I was like, she kept on speaking over and over again. She was telling me about her spouse and telling me about her work, and her kid was driving her nuts, and she was telling me about all of her situations and experiences. And this is not a joke. I looked at her, and I know, guys, this is what I told you. You're going to be a little bit frustrated with me, but I got to share why I did this and how it happened in my evolution. So she was sitting there, and her head was down, and Doc, I'm not getting any better, and all stuff like this, and just that she's just puking out every experience and situation with her. And I paused, and I'm like, man, I got to go for it because I think I have an idea. I may lose her after saying this. She may think I'm a jerk and never come back. And what I did is I grabbed one of my biochemistry books off my shelf in my office because of my desk. And I was paging through it as she was telling me, and I'm like making it kind of over-exaggerated, looking through the book. And I said, man, I never read that book. And she's looking at me. I said, I never read that book. And she said, what book? I said, Things That Losers Say. Yeah. As my media team just started laughing, true, I looked at her, I said, I never read that book. And she's like, what? I said, here's what happens. I said, everything that you have just told me, everything you talked about is everything of your experience and stuff like that, and you're getting yourself all stimulated, all excitatory and everything that way, and you're telling me every situation, and I know nothing about you. All you're telling me is your experiences. All you're telling me is this, this, and this. And no joke. And she said something that dramatically changed my life. She said something to me that dramatically changed my life. She said, Doc, I feel lost. See, I took her out of thinking about her experiences and everything that she's been through. Guys, understand this. I get it. We've all been through shit. We all have. Every one of you guys can tell me a story about your family and how they're jerks. Everyone can tell me a story about how a guy or a woman has hurt you. Everybody can tell me about how something in their work sucks. Everybody can. I understand that. And she kept on sharing it over, and I'm like, listen. And she's like, I feel lost. And I asked her a question. I asked her a question that transformed not only me, but how I deal with even people today. I said, all I hear you talking about is everybody else. I do. I don't hear you tell me about who you are. So I asked that question. That question changed the course of my life. Who are you? Who are you? you tell me is your environment. All you told me was this, this, and this. I haven't even heard who you are. And I said to her, I said, you want something? Stop defining yourself by what you do and your experiences, but understand who you are. And she's like, Doc, I don't know who I am. I said, well, let me ask you a question. Tell me something about yourself. And no joke. And she's like, well, and at this time, it's not a joke. My staff's a little mad at me because I'm starting to run behind. I'm like, just let me sit here for a while. And I ended up literally an hour behind because I said to the woman, I said, who are you? She goes, I'm a good mom. I said, no, you're not. And I didn't mean she wasn't a good mom. She defined herself by what she did. See, and she goes, I'm a wife, and I'm a mom, and I'm a career woman. I said, no, you're not. See, you keep defining yourself by what you do instead of who you are. And guess what happens, guys? These circumstances are going to change constantly. Your spouse is going to piss you off sometime. So if you define yourself by your spouse, by your kids, it's a bad day. It's going to be a mental, emotional stressor that you can't control. There's only one thing I can honestly tell you that you can control in your life, and that's your response. That's it. You can't control your husband. You can't control your wife. You can't control your patients. You can't control your aunts, uncles, your mother. You can't even really freaking control your kids. So if you define yourself by who you are and stuff like that, by what you do, these things are going to drive you nuts. And I looked at her and I said, you're not a mom. That's what you do. You're not a wife. Who are you? She couldn't tell me. So I sat there and I said to her going, you don't understand who you are. No wonder you're stressed out. But then I said to her, if you don't know who you are, then how do you know what to do? Have you ever sat and had the conversation with yourself who you are? See, I believe, personally, I'm going to give you my opinion. I believe, once again, that women suffer from anxiety the most because they define themselves by what they do. Because they actually do more stuff with the kids. They take on being a mom. If you ever notice, guys will suffer from less anxiety, not because that guy yesterday didn't have physical or biochemical problems, but they can laser focus on one thing in their life. They can focus on work, and they can feel no anxiety because their marriage can fall apart, their kids can be hell, but if they're good at their job, man, they can actually not be stressed out because they can stay focused on one thing. Women's biochemistry doesn't allow them to do that. They have to think about many things. So as their kids are having problems or their parents are having problems, I've seen grandmas get sick. So I've seen mothers get sick when their grandkids or their granddaughter or grandsons or actually sons or daughters go through divorces because the situation. I'm not saying they're not bad, but if you're consistently defining your life, once again, by your situations, you're going to have massive anxiety. Let me see a question, guys. Have you ever seen a bad movie? Ever seen a bad movie? I did, okay? You know what I'm saying? And the sad part is sometimes, because we have iTunes, we'll buy it on iTunes because we want to watch it, and like, crap, that sucks. Ask me how many times I watched that movie. Not one time after that. Every one of you guys can actually have a bad movie of your life. You may have been through a divorce. You may have had something happen extremely badly. And what you do is you constantly go back to that movie and you replay that stimulus in your head, and it will cause anxiety. It will. It'll cause massive anxiety. Because why? Because you define yourself by your situation instead of about who you really are. And it's interesting. And when I looked at that woman, I said, listen, who are you? And she goes, Doc, I don't know who I am. So I chatted with her. And I said, what is it that makes you you? And she goes, it's no joke. And she said this. She said, Doc, I'm compassionate. I said, great. What is that? Guys, that's a characteristic. Define yourself by your characteristics. Let me show you what characteristics is. A feature or quality belonging to an individual, person, place, or thing that's serving to identify it. A distinguishing feature or quality. See, characteristics are unique to you. They're unique to you. Let me give you a couple of them. Compassionate, just like I told that young lady said to me. Confident. See, it's really funny. People hate rejection. I don't know why they hate rejection. You know why? Because one of my characteristics is confidence. Do you really think with what I do for a living that I could do this if I wasn't confident? Do you really think I could get up here every Saturday morning and put up videos constantly if I wasn't confident? Because you know why? I'm not joking. I have a ton of employees. I have a ton of docs all over the country. And you'll find out that confident docs won't put themselves out there because they're worried about rejection. See, a lot of you guys are worried about rejection because you're more cared about what a person's going to say than who you really are. See, I have no problem. I guarantee I'm going to get criticism from this video. I got criticism just from actually putting up anxiety itself. But see, what happens is I don't define myself by what I do. You think I define myself by the wellness way? You're crazy. You think I define myself by who I am as a father? You're crazy. Chief Sam, I define myself about the individual I'm becoming and consistently working on myself. But it's a individual trait. So confident, bossy. Well, Doc, that's a bad quality. Really? I can tell you right now that one of my CEOs, one of her characteristics is bossy. See, people say, Doc, there's some bad characteristics, like childish. I'm going to tell you right now. I'm going to tell you, see, all my media team starts laughing. We have this wonderful young lady, 24 years old, just started working for us just some time ago. And one of her characteristics she wrote down was childish. And she asked me, she goes, Doc, is that a bad thing? I said, no, it's not a bad thing. You're like, hold the phone, Doc. How can you say childish is not a bad characteristic? I said to her, I said, let me ask you a question. What's another one of your characteristics? She goes, focused. I said, exactly. Because when your characteristics and you're focused, man, your work that you do is amazing. But when you're childish and you're giggle and you're laugh and we're having fun, it's one of the greatest characteristics. Guess what? And that employee here in Green Bay, I watched her flourish, and she continues to flourish because I love who she is. I'm not trying to change her. I want her to really understand who she is and love it. And if somebody calls her childish, what she will do, she'll end that relationship. Because they'll try to make her something she is not. And if she would stay in that relationship, it would create anxiety. It would create anxiety. See, but if you don't know who you are, how can you share it with other people? How can they understand who you are? You don't give them a chance to understand what you are and how to actually deal with you, okay? Childish, quiet, adventurous, cautious. Look at two opposite spectrums. Ladies, if you're more of a cautious, relaxed person, don't date and marry an adventurous guy. Honestly, because you're going to drive people absolutely batty, because he's going to want to go out and hike and do everything, and you may just want to hang back and watch a movie. You may want to do this. Do you see what I'm saying? But if you don't know that about him or her, it could be vice versa. Let's say the woman wanted to go hiking and do something, and the guy was a little bit more cautious. If you don't know that and don't understand that, you may even be good people, but you'll grow apart, which will cause what? Anxiety. Do you see what I'm saying? And so it's really funny. I always tell people, so once I start to really understand people, and even as a doc, I found that a lot of people, if they didn't have biochemical or didn't have physical problems that led to those things I explained before, what had happened, they had emotional things that were significant. And I'm going to tell you right now, there's a great website out there, and Brandon will put the link down there. It's free, it's nothing. I don't have any ties to it. I just found it lists all the characteristics. Can you guys do me a favor? Do me a favor. If you suffer from any anxiety, I don't care what it is, can you please do me a favor and write down and go to that website? And remember, I have no ties to it. It's just a website. You can click and just type in characteristics. You'll find it down there. And it lists hundreds of characteristics, A to Z. Can you write down your characteristics? Get to know who you are. You need to know yourself. Because if you don't know yourself, how can you be good to other people? You won't. You'll be like a boat in the middle of a lake, and guess what happens? With no paddles, and the wind is going to push you wherever it wants to. And then you're out of control of your own life, and guess what happens? That does create anxiety. Do you understand? So it's really funny. So when people say, Doc, so I'm understanding who I am, I'm really defining it that way. Now, remember, what do I do? Well, there's something that I've learned big time. My life is not dictated by my circumstances. It's dictated by my priorities. We all have circumstances. And I know some of you guys right now are saying, Doc, you don't understand. And remember, as a doc, this has happened more, and it's devastating, and it's a horrible circumstance, and I wish that they'd castrate the guys that did this to these women. There's women I know that have been raped. I mean, actually, and the people are in jail. They are. And that is a devastating, disgusting circumstance for a woman to deal with. I mean, it's absolutely, I can't think of just a more disgusting thing that a man could do to a woman, okay? And obviously it doesn't really happen the other way much, you know what I'm saying? But the idea is this, those women have extremely bad circumstances that they have experienced. But why do some of them overcome them? You're saying, why do they stop playing that bad movie in their head? It's because, guess what? They don't let their life be dictated by the circumstance they went to. Once they knew how they are, they knew how to prioritize their life, and they worked on it every day. You guys have seen me do this on a continuous basis, talking about that I focus on my priorities every day. I can honestly tell you, you guys see me now today. You think that I wasn't a stress to my wife, young in marriage? You think I wasn't, some of the things, I told you before, I've said this many times. I've actually learned to be a better husband, dad, doctor, everything, through all the things of learning how all this worked. And so when I started to realize, listen, my circumstances, guys, I have a national company. I have an international company now. Do you really think I don't have circumstances where I want to kill somebody every day? Every day. But I'm not dictated by my circumstances. If a doctor does something stupid, okay, or if there's a patient that drives you nuts, or if there's a business thing or thing like this, guess what happens? It's a circumstance. I don't suffer from it. You understand? Why? Because I try to take care of all the physical things. I have great hormonal processes. I keep those physically. I don't do the stimulants. I don't do all those biochemical things to throw it off. But then even if you did everything right, even if you did, if you have that emotional component, it can create anxiety even sometimes faster than the physical and actually biochemical things can. Actually, here, if you think about this, if I were to get you into a state of panic, all those biochemical things would change in a very negative way anyways, okay? So I want to go over this again because people have been asking me, say, Doc, what do you mean by priorities? Well, I had a doctor call me, one of our doctors, as he's figuring himself out, called me and said, Doc, how do you know what you want in your life now you know what you are? It's simple, your priorities. And then there's a ranking of your priorities to actually dictate my life. So my circumstances don't dictate it. What I want in my life does. So what I'm going to do is I'm going to show you my priorities. I got to find my marker too. So Brandon, let's go to our studio. Okay, so now, as I'm listing my priorities, I put this up here, Patrick's priorities. I didn't put priorities, I put mine. These are the things that I want to work on every single day that dictate my life. So once again, this is my life. Believe it or not, Christy's is not the same. Let me say it again. We've been married, like I said, we've been married 18 years. We've been together 20. We just had August 1st, is kind of cool. My wife and I, started dating August 1st, 20 years ago. And actually we got married September 28th, 2 years later. It's kind of cool because what happens is this, and Durham, Christy's priorities are different than mine. They're supposed to be, she's not me. Do you see what I'm saying? But the one thing I will tell you is this is what I focus on every day. Doc, how many days a year? 365. Now here's what happens. Because people don't understand priorities, this is what brings me great joy in life. Me. Not Brandon, not Uriah, not Dr. Jacqueline, not Paul, me. This is what I want to do. And I believe there's a ranking to them, okay? And I go back to my priorities video if you want to see that. But here's what happens. So then I get up every day not looking at circumstances. Not looking at circumstances. I go, okay, guess what? My faith in God, working on myself, my wife, my kids, wellness way, and golf every day. Now, some of you guys may say, Doc, golf, really? Yes, I'm not you. You saying? And for example is this, and guess what happens? Guys, think about this. I want you to think about something. Do me a favor. Just right now let me explain why. Let me do this before I have you do that. Why do I have these in order? And there's priorities, there's rank. That means, once again, our faith in Jesus Christ, that's number one. By far, it's priority. Do you know what I'm saying? Now, that's what we want to do. And me and my wife have the same priority. But here's one thing too, self. This is where women start anxiety right here. This is where women start having anxiety. I hear women say the dumbest things. And I hope I just ticked most of you guys off, because I want to tick you off. Otherwise, you're continuing to perpetuate things that give you anxiety. Ladies, stop telling me or stop saying that your kids are more important than you are, that your husband is more important than you. I have to take care of him. How's it working out for you? With the exception of God, the only thing that you can put above yourself, for example, is God. Anything that you put above yourself, you'll eventually resent. Let me say that again. Anything that you put above yourself, with the exception of God, you'll eventually resent. No, my beautiful child. I've seen you guys actually hate them. Your husband, you hate them most of the time anyways. See what I'm saying? When you put them first. This is not a joke, ladies. And you think that your words, because we live in a messed up culture that says, I put my child's needs above myself. Yeah, how you doing? How are we doing? You know what I'm saying? Your children never come. Here, I always tell people this. This is how I came up with this. In the Bible, it says, love thy neighbor as you love thy child or your husband. No, it doesn't. It says, love thy neighbor as you love who? Yourself. You cannot give from an empty cup. You want to talk about anxiety? Keep giving, ladies. Let me give you an example. I hear this all the time. Man, a wife is so stressed out because she just does everything for her husband, everything this way, and all of a sudden she's done. She now resents him because she put her man up here, and then she is done. She's just like, I can't take it anymore, and she goes and talks to him, and he's like, what? I thought everything was great. But I've been taking care of my husband. I've been submitting to him. You guys don't understand what submitting means. It's Christian BS and some of that stuff. Okay, but we'll get to that. Okay, I told you I'm going to take a lot of you guys off today. Okay, because here's what happens, is when you take care of yourself, now what happens is everything in your life is going to get better. I get up every day and work on myself so my beautiful bride and my kids' wellness plan and everything I do actually benefits from it that way. And it doesn't create anxiety. When I actually get up and I work on myself, I know that my wife deserves the best form of me. And I'm not doing it for her. I'm not doing it for my kids. I'm not doing it for them. This is a priority list. I know that I have to be the best for you guys. You're right here. You guys are a priority for me. So, Doc, why don't you have 13 priorities? I'm not good enough. I'm not. I know myself. I know my time management. I know what I want to focus on. But I get up every day and I work on those things. And it brings me pure enjoyment. But Doc, some doctor could tick you off. Not dictated by my circumstances. My joy doesn't come from that. Doc, wait, you and your wife agree on everything? No. My wife and I are totally opposites. But you love her dearly. Yes, I do. And on top of it, here's what happens. Let me tell you this. Look who's next on my priority list. Christy. Oh, it should be your kids. No, it should not. How's that working out? You put your kids above here. If I focused on my daughters more than I focused on my wife would resent the kids. You saying? Don't tell me you're a wonderful dad and you suck as a husband. This is my personal feeling. For one of the greatest things, guys, I'm speaking to men now. Guys, one of the greatest things you can do for those children is love their mother like crazy. My girls watch that with her. They see that every day. You love that woman dearly, and those kids will be a lot better. I don't care if I take my girls golfing all the time. I don't care if I spend all the time with them. If their mother falls apart, I'm not a good dad. And I get up every day and knowing that this beautiful bride of mine is a priority above all these things. And therefore, guess what happens? This benefits, this benefits, this benefits. Guys, look at this. The wellness plan is not my life. It's a part of my life. My faith in Jesus, myself, Christy, kids come before this. I teach every employee this. Because if this is out of order, if your priorities are out of order, stress and anxiety. It is. So when I get up every day, I'm like this. So I thank God I don't suffer from some of the things you guys do, like the physical and biochemical problems. But once you get those things resolved, I really find out that guess what? People don't know who they are and they don't know how to prioritize their life. Now, once again, I can honestly tell you, Christy and I have the top 4 priorities the same. You know, she's here and then I'm here, but she has different priorities here. She does. It's kind of cool. And that's kind of neat. And it's kind of cool. And I know what her priorities are. And one of my priorities is her. So one of my priorities is actually helping her accomplish her priorities. what she loves. Guys, you want your woman to fall deeply in love with you and keep her stress down? Value her priorities and help her accomplish them. Let me tell you something as an employer of hundreds of people. Understand their priorities and help them accomplish them. The Wellness Way as a company, I'm not about them being all about work. That would actually be against everything I believe. But I'm trying to help them live their life, not mine. And their priorities, for example, are important to me because I just want to be with a bunch of people that actually want to grow. And so I started to do this, and everything started with me clinically. I started to recognize that, oh my goodness, people are clueless of who they are. They're clueless. But how do you know what to do if you don't know who you are? Sit back, get those characteristics. And then once you understand your characteristics, list out your priorities. Do you see what I'm saying? I love doing this. Will I ever get 7 priorities? I don't know. Will I ever go down to 5? I don't know. See what I'm saying? And that's the cool part. You don't have to know everything. But you know what I do know? I know tomorrow. So when people say, Doc, what are you doing today? My 6 priorities. Doc, what are you doing tomorrow? My 6 priorities. And it's what I love. Do you see what I'm saying? So I'm consistently working on those things on a regular basis. And believe it or not, it's massively enjoyable. It doesn't lead to stress. It doesn't lead to those emotional things that can cause anxiety. Let's go back here, Brandon. All right, you got me? So now, to recap a little bit this. Yes, don't get me wrong for you guys. Some of you suffer from anxiety because there's physical and biochemical things. Please, I beg of you, get tested. Find those things that they're the stimuluses that cause the response to lead to that constant excitation of even one thought. If you have a biochemical problem and you have a negative situation happen, it's almost out of your control. You need to get them fixed. That poor 7-year-old, that poor 33-year-old, that poor 34-year-old, it was out of their control. And that's why the anxiety exists there. They had physical and biochemical changes that happen that way. It happens. It's very devastating, okay? The emotional aspect. I really want you to really dig deep and figure out who you are. It's one of the greatest joys I can ever tell you this, is when I help other people figure out who they are. Not what I want them to be, but let me say it again, who they are and love it. When Carly said, one of my features is childish, I'm like, I love that about you. She lit up like a Christmas tree. Because other people in her life, including family members, told her that was bad. You're saying, you gotta have that self-love. And that's what working on yourself does that way. There's one final thought that I want to share with you guys though. And this is something you guys have never heard me taught, except for my team has been hearing me to teach this a lot lately. Because while everybody's actually wasting time, when everybody's doing things that don't matter to their life and not working on their priorities, I am. And people say, I don't have time. Guys, you have just as much time as I do. I get great sleep every night, and we have the same amount of time every single day. Then why is it that, for example, some people accomplish more? Because they're great with their time. And I don't want to waste time. We've got one shot at this. So what happens is I always think about it, and I'm watching people's behavior because I know it affects them. I tell you guys, the reason why I work so much on watching people's emotions, because I believe it's the biggest contributor to why people are sick today. And so what happens is this, and I see stress come from a lot of relationships. And I'm talking friendships, I'm talking families, and I'm talking marriages, I'm talking everything. And I believe I've come up with something, and I started sharing this with everybody, so my team will hear me repeat this, but I want to bring this public now for the first time. I believe I finally have an idea why any relationship, in any form, from a friendship to a job to a marriage to everything, will not survive. Why it will end, okay? It's simple. See, people try to tell me circumstances. Oh, a marriage ended because of adultery. Nope, there's people that have adultery all the time and still together. There's people that, for example, there was abuse. Nope, I've seen people stay with abuse for a long time. And they give me every situation. A friendship, they treat them bad. You have a horrible friend, and they're still the friends. Okay? So I believe there's only one reason why any relationship, from me owning the company, I actually believe I figured out why people will leave. Get this, by me being a doctor, by our doctors across the country, I believe there's one major reason why people will not stick with our doctors. Well, doc, it's financial, they can't afford it. That's not true. There's only one reason why any relationship in any way will ever end. It's because you can no longer see a future with that person. So your spouse could have made a bad mistake. Trust me, I guarantee I've given my wife plenty of reasons to leave me. My friends, I guarantee I've done things to them. Trust me, guys. I guarantee employees, I guarantee everything. I never did everything right. I actually probably have a reason to have anxiety like crazy. There's people that actually despise my name. There's people that despise my name because I actually talk about anxiety different right now. But here's what happens is this. But here's one thing. It's one of the reasons why you still watch my videos. Is because you can see a future with what I'm teaching better than anybody out there right now. Why is the Wellness Way growing as such a big company? Because doctors across the world are seeing a future with our company than anyone else. Why am I with my beautiful bride? Why is she with me? I'm with her because I see such a beautiful future. See, if you can no longer see a future with somebody, it's going to end. And if you continue with that relationship and don't see a future with it, it's going to cause massive anxiety. I mean this sincerely. Right now, if you have a spouse you don't see a future with, I never want to see anybody get divorced, but your anxiety is going to continue unless you leave that person. If you're in a shitty job that treats you like crap because they treat you like a number instead of an individual, and you can't see a future, I already know you're planning your exit. And you should. Don't stay there. It will cause more health problems. See, I'm talking about health problems than anything on the planet. Because every day, see, it's really funny, think about this. I think the term, thank goodness it's Friday, is so stupid. I think, for example, that Monday is the highest anxiety day on the planet is so dumb. Because once again, people are living the lives that they don't want to. People are being forced into situations, but here's one thing I'll tell you. You do have a choice. And the only reason why any relationship or anything from a career to anything is going to end because you can't see a future with it. And if you stick with it, I hear people say this all the time. I hate my job. Okay, why do you do it? Well, I got to take care of my family. Yeah, then every day you're going to wake up stressed. How good is that for your family? What if I told you, ladies, that kind of mindset could lead to the reason why you're so sick today, why you have anxiety, why you do these things? It's true. See, it's why sometimes guys themselves will focus on their career and nothing else because that's the only thing they can see a future at. That's not a future. That's a lonely future. You know, those 6 things in my priorities are things I see my future with every day. I'm hoping that I continue to bring you guys such valuable information. I get up every morning knowing that I have hundreds of doctors. I get up every morning knowing that I have hundreds of employees. I get up every morning knowing that I want people to see a future with me. It's why I work so hard on myself. It's why I work so hard in priorities. And it's why I ask everybody to do it. I ask you to do it. I'm telling you, it's joyful. It's very joyful. So if you're suffering from anxiety and there is no physical or emotional or physical or biochemical problems, I want you to sit back and write down your characteristics. I want you to tell me. And if you need to, email me. Send them to me. I would love to know what they are. I'd love to know your characteristics. I'd love to know your priorities. Email me at askdrpatrick@twclinics.com. Please. Or I think it's, wait. Oh, it's all right. We changed our web. We got our own domain now. askdrpatrick@thewellnessway.com. Oh, okay. Guess what? Hold the phone. See, I just work here, okay? See? AskDPF@thewellnessway.com. I would love to know who you are. I'd love to see you live a better life. Because once again, it's all health related. See, this thing that you can just chemically change anxiety with a drug or some psychotherapy or things like that, the human body is much more complex than that. There's so many factors. There's so many gears in Swiss watch that works that way. So as you look at those thoughts that way, I want you to take what I said today very seriously. I clinically teach all the docs to do this. I teach all of them to actually deal with their patients this way. Yes, I know when I was actually going through like that woman that had anxiety. Now, turn around. So are there some natural things that calm some of the anxiety down? Yeah, there are. I believe it's why actually marijuana is used so much today. It's bringing down the stress. It's people forgetting about their life for some short time that way. It's why there's even illegal drug use. It separates them from the life that they don't know who they are and didn't plan. Because nobody teaches you. I told you guys last week on my bedroom talk with Christy, nobody taught me how to be a man. Nobody taught me how to be a husband. Nobody taught me how to be a father. The sad part is who had taken the abuse from it? My wife and kids, and my employees and all the people. But the sad part is this, I didn't stay there. So when that woman came in and she was shaking her great anxiety, guess what happened? I knew that her body was under high fight or flight. Her hormones, her cortisol, all going to be off. So I gave her it's not a joke, it's the second most sold thing at any clinic that I own. It's called California Poppy. Actually, it's a state flower of California. That's why I even pulled out the anxiety thing from California. They talk about all drugs on that website and don't realize that California main flower, that herb, is actually such a anxiety and calming reliever, it's ridiculous. I can tell you story after story. Now, did it fix her problem when she came in? No. It just gave her something that relieved her a little bit so she stopped shaking, and now I could dig into the physical, biochemical, and emotional things and reverse those processes for her. That young lady that sat there and I looked at her and said, I never read that book, Things That Losers Say. Okay? Yes, you're right. I had this shock and get her to think differently because she kept on telling me stories of her situations. And now it's really funny because patients that have been with me for a long time, if they don't have a biochemical or a physical thing that come in like the guy yesterday, I can tell you right now, knowing his history, I ran his blood work because I know he's going to have low testosterone. There's no doubt. There's a biochemical thing. So what came out of me during that appointment was compassion for a suffering individual. I would never say to him, you know, like I did that woman that I was taking care of for months and saw that her major thing was emotional. That guy that showed up yesterday, wonderful man, wonderful husband, wonderful father, but massive anxiety, he had a biochemical problem. I understand it, guys, I do. If you're suffering from those things, I get it. I get it. I deal with that clinically. A lot of you guys have anxiety because of number 3, that emotional component. And see, here's one thing. What do you see? Do you see the square or do you see the round circle? It depends the perspective you come from. It's all about your perspective. I've always felt my whole life like a square peg and a round hole. Everybody's saying it's round. I'm coming from a different perspective saying it's a square. And what happens is when you tell people that you see a square instead of a circle, sometimes people get damn right angry. But I got a question for you. How are we doing? The whole world is massively medicated. The whole world is massively unhappy. You think I'm joking? Turn on the news one day. I love politics. I really do. But turn on the news today. People are suffering. People are going through rough things. Divorce is at an all-time high. Sadness, medications, psychiatric drugs, all-time high. How are we doing? We have to stop looking at it like it's a round circle and start realizing it's square. You know what I'm saying? And I want you to be the square peg in a round world that's telling you the way it is. Remember, the people who made the world to stay the way it is are no smarter than you and I. I don't play that game. I'm creating a new game. That's what the Wellness Way approach started as. It's why, and here's why. And why this relationship of you and I talking will continue is because I will always bring you massive value because you can see a future with what we're teaching. I believe that as a company. I believe that me as an individual. I believe in every doc that exists here. And as I told you, that's why we have to stop listening and start learning. And I'm going to bring up a dear individual and her wonderful husband up here from Colorado. So, Dr. Jacqueline, you guys got a mic for her? And Paul? Wonderful practitioner in our South Denver area. They're going to grab a mic that way. I want to just like, for example, as you guys know, I love when people come and train with us. So, Dr. Jacqueline coming up and Paul, they actually are physically staying at my house. All my board members, with the exception of Thomas Laura, because they live on their own, stayed at my house. Why? Because I'm proud of what we're developing. I'm proud of what we're doing as a company. I'm proud. And these two saw a future with us and met us from a different doctor. And now they have a beautiful clinic out in South Denver. Yes, you can get medicinal marijuana out there legally. Okay?
That's correct.
That's correct.
That's correct.
So thank you, Colorado, for being smart. Okay? So anyways, hey, docs. Hey, how's it going, Paul? So why don't you tell us a little about yourself? I'm going to step out. Give you a little chance to speak to everybody from all over the world that way. Tell us about yourself. Tell about what attracted you to the Wellness Way, and also don't forget to tell them that you guys have 2 awesome little boys, Owen, okay, and then they also have an 11-month-old, So it's pretty awesome. Declan, yes. So sorry. So introduce yourself.
Awesome. Well, super excited to be chatting with everybody today. We're so excited to be hanging out with Dr. Flynn, Christy, and girls from the Wellness Way team. This has just been a huge blessing for us. I'm so very blessed. So I just want to chat a little bit about what brought us into the Wellness Way. My husband Paul, who's in the fire service for 14 years. Massive health issues, and that is truly what drove us to Wellness Way. So he suffered, I'll just let you describe it. You're really good at that. That way I can go into it too.
Yeah, so I spent 14 years with the fire department in various areas. Started as a firefighter, and then I worked my way up through the ranks to be a fire investigator. And literally right after I started working for the fire department, there we go. Sorry. Literally right after I started working for the fire department, I started developing massive sinus issues. Sinus pressure in my head so bad that I had to heavily medicate myself. And it never really stopped while I was in the fire department. And through the course of that time, I was in the fire department. I had and over 10 years. And working with my wife, she always tried to figure out what was going on. Oh, that's all right. So she, we worked, day and night to try and figure out, what was causing my issue. And, we lived a healthy lifestyle. We knew some of the basic things, and it just never got better. It never, subsided. It would, after surgery, it would go away for a little bit, and then it would be back. And then towards the end of my last surgery, I completely lost my smell and my taste for roughly about 2 years, which, caused me anxiety. I went into a small state of depression. When you can't smell or taste your food that you're eating every day, it really starts to affect you. And then not only that, the job of a firefighter or fire investigator is very stressful. And, when Doc talks about his priorities and the company of the Wellness Way, I worked for a fire department that didn't support my priorities, and just the environment there caused anxiety, and that I took that home. I was a terrible husband for a while. I was a terrible father, and that's why I got out. So, but today my Wellness Way story is after testing and working with Jacqueline and all these other fabulous doctors, my smell's back, my taste is back. I'm healthier than I've ever been. And it's just been fantastic for me, so.
Yeah, I'm just thankful because, I was doing all the things I thought were working and helping him, but we never, ever had answers until we started testing with the Wellness Way approach and started actually going through the process that all of our doctors across the country understand how to do with their patients. Yeah. And I'm so thankful because also as a wife, it's hard to have a partner that is struggling with this stuff, you guys. Like I've walked that walk with him, and not only as a wife but as a doc on all those levels, being frustrated because I feel like I can't help him. So I truly understand what it's like to walk through that walk as a spouse, as a doc. That's the heart I have for all my patients too. I want them to get the answers. I want them to have that breakthrough and get their health back, because your greatest wealth is your health. Yeah. That is so true. There is not enough money in the world. There's not anything that you can do if you don't have your health. Yeah. So, and I was actually just talking about this with Christy last night. Our kids, I'm very, very passionate about helping them stay healthy. This next generation, you guys, I'm seeing kids younger and younger with anxiety showing up on medications, and it is scary. Those kids deserve better. They deserve answers. So that's just a little bit about us, and we're very passionate about helping others achieve good health.
Yeah. Awesome. Well, thank you, Dr. Jacqueline and Paul. I appreciate these guys being here. So I'm going to finish up here, so they're going to grab a seat that way. Let me tell you, it's not hard to see when Paul and Jacqueline speak about their love, about their passion, about what they experience and what they see. And guess what happens? For them to go through, how Paul was sick as a firefighter, to recap that way, when I met her, I saw Paul's labs. Now remember, he's young, and his liver was horrible. His actually things that couldn't get under control, and of course their obviously aspect was to medicate them. And Jacqueline, knowing better, but didn't have that method of doing stuff, it was frustrating her. It's no different than, her story is really no different than mine when I saw my beautiful wife, when I met her, and she was suffering. And the doctor said, do this. It was tough. See, our heart, our compassion, those are our characteristics. You know, the thing that allows us to be great docs that way, to bring stuff like this to you. So, you know, sometimes when you see those stories, it's devastating. You guys that suffer from anxiety, it's devastating. But if your answer is to just continue to manage it with certain medications, that's not living the life. You're not getting to what is really the issue that really led to it in the first place. Unlike PMS, where I think they've actually just threw a bunch of symptoms together and actually gave it a term like premenstrual syndrome, anxiety is very real. So I understand the diagnosis, I understand why they do it, I understand what people go through, but I'm saying, coming from a different perspective, going back to this, remember, their perspective comes from around the circle. I'm saying, guess what? Our perspective is different. And Dr. Jacqueline said, listen, not only do I see this helping my husband, now I can bring it to my area and people all over the world. So guys, go to our website, thewellnessway.com, and look at all those docs. You will continue to see us bring doctors here on a regular basis. I'm very proud when people come to the Wellness Way Green Bay and watch Dr. Jason, Greg, Dr. Mitch, Nicole, and all of our practitioners, Dr. Jesse and Zach and Appleton, and come here and come to these offices and watch what we do on a regular basis. I'm very proud to where Dr. Jacqueline and her family and Paul come to our house and see, once again, a family working on their priorities, people building the life that they want and actually doing and bringing, you know, goodness to people. There's too much badness out there. There's too much stress out there. There's too much stuff. You know, it's kind of funny. I always tell people, sometimes if you set yourself on fire, people will come watch you burn because it's cold world out there and people need some heat. People need some comfort. Okay? Do me a favor. Please continue to like and share. Please continue to share what we're sharing with you. I promise you, you will see us work. You'll see me work relentlessly on my priorities. So every day, I have a standard. I want to work on myself at such a level that my wife always sees a future with me. I want to work at such a level that Brandon, Dr. Jacqueline, people see a life with us. Because why? Because that's how you build a life. That's how you create joy. Is to continually do life with great people, work on yourself, set those priorities, and get your butt going every day. We all have the same time. I actually have a great schedule for my day to day. I get to spend time with wonderful people. I spend time with my wonderful wife and kids. But you know what some is this? Doc, what are you doing today? My 6 priorities. Guys, what am I doing tomorrow? My 6 priorities. With that said, I believe that the things I share with you today give you a very different perspective on anxiety, but not only life. Please comment below what you think. If you think I'm full of shit, say it. It's okay. Guess what? I'm confident. I don't really care, okay? You know, that's the cool thing about having my characteristics, okay? But the idea is this. But if you think what I said today made a difference in your life, can you do me a favor? Can you give me a green heart? Because you want something this is, as I work on my priorities, as I point to my studio in the screen there that way, there's not one person on this video that doesn't want to make an impact on people's lives. And that life may be their spouse, that life may be their kids, or it might be other people around you. I actually have said this, and I've been blessed to get a lot of attention right now. But I always told people, I don't want to be famous, I want to be influential. I want to be an influence to people to bring, once again, goodness to their life. And guys, guess what? The Wellness Way and all its people are good. They're good. I get to spend time with them. It's a wonderful time, but I also get to spend time with you guys. So God bless all you guys. Remember, you need to stop listening and start learning. God bless you guys. Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.